do we, over the next 6 months, end up with some very different tools at our disposal that actually change our strategy? And obviously the one that we would all love to see is if in the next 6 months we got an effective or fairly effective vaccine or highly effective drugs. I think Patrick and I certainly would be very surprised if that was the case, but very pleasantly surprised, and we're working as fast as we can to achieve that. But clearly that would lead to a significant change of strategy. I think the second thing is we are learning the whole time, not just from our own experience, but the experience of other people around the world. And Patrick and I both talk to our opposite numbers in many other countries to learn what's working and what's not, and read a bit behind the headlines, because what you read in the newspapers and what actually is the reality are often quite significantly divorced from one another. I would be very surprised if our strategy in 4 months or 5 months' time was identical to the one we have at the moment. I mean, the bare bones of it will be the same. We will still be wanting people to isolate if they have symptoms and have contact tracing. We'll still want them to have the measures which protect others. Like face masks, we'll still be needing to have some local outbreak responses. But what we need to do in terms of the wider strategy and how we can do the maximum damage to the virus with the minimum damage to our society, that is going to evolve over time. And some of that is from learning from other people, and some of that's as the science emerges.